All right, path and lab medical necessity. Like I said to Boyd earlier, I said, did you notice that theme? We've been doing some E&M stuff tonight. I understand medical necessity, but I can't seem to figure out how to apply that to Medicare, Medicaid rules, both LCDs and NCDs, which means local or national. What am I missing? I have trouble with coding this area anyway, and I was told this is an area most people score low on in the CPC exam. Well, it is true. A lot of people struggle with this area. And I think it's because it's a little bit intimidating. If you have a clinical background or you've been in medicine a little bit longer, it tends to not be as difficult, but it's the verbiage, I think, that makes people stumble. Well, there is a reason you could be struggling. And again, I mentioned that the LCD and the NCD, it means local or national. It's a list. But if you submit a claim for payment, okay, and for a test that's being done, and you don't have a specific diagnosis to back up that CPT code that says it's medical necessity, they're not going to pay it. They're going to deny it. So an example of that is that the diagnosis coding that's going along with it, and I'm not saying it's the coder's job. It is the person that one is doing the billing. You got to associate the correct diagnosis out of all of the diagnoses that are given that go with the lab test. Okay, so you can't just take the top one that's given. It has to correlate. So you can't have an HA1C done because the person has an upper respiratory infection, because that doesn't correlate. That doesn't show medical necessity. But if the person's a diabetic, they have an upper respiratory infection, and the doctor's going to be putting them on a prednisone, which makes that patient's blood sugars go wonky and everything, and they say, hey, we need to see what your blood sugars were running. So the diabetes shows medical necessity toward the reason for that particular lab. But the reason they were being seen was for an upper respiratory infection, and that was top listed. That's why they were being seen. So that's what they put when they sent it off to the labs. And so therefore it goes through the system like that. There's no medical necessity associated to those. So you, again, need to know the disease process. You can't just pick a code. It has to be a specific diagnosis code that shows medical necessity, or it's not going to get paid. Now, also, when you look at LCDs and NCDs, this was something very informational. You have, if you want Medicare to pay, then they'll only do it if you have an ABN completed, meaning an ABN, and we've done lectures about ABNs before. You can go to our YouTube channel, or you can go in the club and look all over the place. We talk about ABNs. When you have a patient fill out an ABN, it's Advanced Beneficiary Notice of Non-Coverage. So they're saying, hey, this might not be paid by Medicare, and this is how much we expect it to cost. It's going to cost $50. So if they don't pay, you're acknowledging that ahead of time you might be responsible for that. Okay? So they're not going to mess with it if they don't have an ABN in place. Just keep that in mind. So what does Medicare pay for? They do, it says this policy applies, oh, by the way, to all Medicare Part B providers. They have to have that ABN, okay? But a diagnosis code provided must reflect in the patient's medical record. Okay, so let's go back to our guy that needs to have an H1C done because he's diabetic and he has an upper respiratory infection, so the doctor wants to have this run. You have to be able to show in the medical record that the patient's diabetic, okay? And so that's part of the documentation process. Medicare does not cover routine blood work. They just don't cover it. That being said, that could be part of the problem with the medical decision making also, they just don't cover it. That's why you're going to get denials, and that's why you don't hear a whole lot of education about the medical decision making associated with it, because it's not covered. And if it's not associated to money, it's like the greasy wheel. Well, we don't talk about it because nobody pays for it, or Medicare doesn't pay for it. However, do know that inpatient or in a hospital setting or a skilled facility, you could get coverage under Part A in those specific scenarios, okay, if the patient's inpatient. Now, regardless of the rules that Medicare doesn't pay, blah, 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 there are two basic requirements if they are going to pay, and we've already mentioned them. Medical necessity has to be established. Okay, it has, so you can't just pick a diagnosis. You got to have a diagnosis that's correlated to that particular lab test. Also, it has to be prescribed by a licensed provider. I'm getting feedback. Last, it has to be performed or delivered by a healthcare provider who participates in Medicare. If they don't participate in Medicare, well, of course they're not going to pay for it. That it's going to be, thrown out. Now, the person who submitted this question did not necessarily say that she was running into Medicare patients, but that's what commonly happens, okay, when you see questions like this. I'm having problems putting together the medical decision making with Path and Lab, and these are the reasons why. Medicare doesn't pay. The provider that's wanting to do it isn't a Medicare provider, and the diagnosis is not associated with the lab test that's being run. So there's a disconnect somewhere in there, and that lab test not being associated with the diagnosis, I would say, is the number one reason that people struggle with it. And that's it. Good stuff.
All right. Thank you.
Do you need more medical certification and business training? Learn more at www.cco.us.